Hey guys, Lisa Halligan from lisahalligan.com here, and today I'm going to be discussing a medical issue. So I want to make sure that you understand that I don't want anyone making changes in their medical treatment plans without talking to your doctor first, okay? I'm a nurse, I'm not a doctor, and I'm not your doctor, okay? So I'm here to provide medical information, and your doctor's the person who's going to help you to incorporate that into your lifestyle, okay? Very, very important. I also want to make sure that you realize I'm not bashing the medical system here, okay? The medical system, if I thought it didn't have anything good to offer, I wouldn't be a part of it, okay? We're very good at managing crisis. If you get shot, you want an ER. There isn't an essential oil for that, okay? Car accidents, heart attacks, strokes, burns. We're your peeps. We're going to hook you up, and we've got a very good track record of getting you through it, okay? But where we suck is at preventative medicine. Most of you know my most frustrating moment with a doctor ever was when I showed him the blood results from an insulin resistance test. Now, first of all, I had to have a friend who is a nurse practitioner order that particular test because the doctor refused to do so. And when I showed him the results from the test, which were moderate to severe insulin resistance, he tossed it down dismissively and said, "I'll treat you when you're a diabetic." Hi, Ellie. So it's really important. That's all too often the attitude. Don't worry about making lifestyle changes. Don't worry about changing your diet. We have procedures that will detect your disease. I will. And drugs and pills that are going to fix everything under the sun. Now, people are really overconfident about these pills and their procedures, and a lot of that has to do with what their doctors tell them. So one medical test that I wholeheartedly recommend is the annual pap smear test. Studies have shown that if you get your annual pap smear and you follow your doctor's advice, your risk of developing cervical cancer is less than 7 out of every 100,000 women. That's a great test. It's a great procedure, and it actually works. Unfortunately, not all of the procedures and tests and pills that we use work that well, okay? Something that is very dear to me is heart disease. My husband's had 3 heart attacks. His brother died of a heart attack at a very young age. So anything that I can find that will lower risk of heart attacks is important to me. Okay. One of the things that they always recommend is cholesterol reducing drugs. That's one of their go-tos, is a statin. Okay. But yes, thank you, Will. How well do these drugs actually help us to prevent heart attacks? Most people would willingly take a drug if it reduced their risk of getting a heart attack by 100% over the next 5 years. Absolutely, that would be a simple choice. It would be foolish not to take the drug, no matter what the side effects were. Studies have also shown that if a drug only reduced the risk of getting a heart attack by about 50%, most people would still consider that a worthwhile risk reduction and worth taking the medication every day. But what if the actual benefit from the medication was less than 5% over the next 5 years? Would that be enough to convince you to take statins every day? Especially when 29% of people stop taking statin drugs due to muscle pain, okay? And in rare cases, and I do mean rare, you can develop a life-threatening muscle reaction called rhabdomyolysis. This is a condition where your muscles get damaged to the point that you have severe muscle pain, liver damage, and kidney failure. And I want to stress this is extremely rare. But part of why it's extremely rare is most people stop taking it when they start to have muscle pain. Nobody really wants to continue taking a drug like that when they're in severe pain, okay? It's also worth noticing that you have a higher risk of developing statin-induced rhabdomyolysis if you have certain risk factors. Low body mass index, you're a senior citizen, you're female, you have hypothyroidism or hypertension, you take a large number of other medications, which most people with heart disease do, or if you abuse alcohol or recreational drugs. Another rare side effect of statins is liver damage. Thanks, Will. About 1% of people taking statins will develop true liver damage. And that's fine if you're getting a 30 to 50% risk reduction, but the actual number is a 3.1% reduction in lowered risk of heart attack. Okay? And what if you're at risk for diabetes? In 2012, the FDA put a black box warning on statins because they can raise... Hi. The door is locked, yes, because it was supposed to keep you out. Yeah. Big door. Statins raise the relative risk for glucose levels in people who are at risk for type 2 diabetes by about 9% to 27%, and that can be significant. So the actual absolute risk reduction over 6 years for the very best statin drugs is 3.1%. Is it worth it to take these drugs for this level of reduction in heart attacks? Maybe for you it is. Maybe it absolutely is. Maybe for you it isn't. But wouldn't it be great if your doctor actually told you what these numbers are? So why don't they tell you what the numbers are? They generally don't discuss these numbers with patients because they know that patients aren't going to take these drugs every day with these risks for a risk reduction of 3.1% over the next 6 years. They just aren't. But they also know it's not a huge risk for the individual, but if everyone stopped taking statin drugs, it would have an impact on the population at large. I need what, honey? Yes, thank you. Okay, the thing is, there is something that we can do to lower people's risk of heart attacks. There is an intervention that, if practiced faithfully, will give you an absolute risk reduction in heart attacks of 60%. Now remember, statin drugs, 3.1%. I'm going to be discussing an intervention that has a 60% reduction in your absolute risk of having a heart attack. It doesn't work immediately, but it does work. Yeah, and overall 99.5% of patients who stick with this intervention avoided major cardiac events, which includes death from heart attacks. Wow. Even better, this intervention does not raise your risk factors for things like diabetes. It lowers those risks as well. So do you want to hear what this miracle cure is? A whole foods, plant-based diet. Yep, an intervention that simple is amazingly more effective than that pill. I mean, the pill doesn't do anything about 97% of the time. So this is not really a hard decision. And I'm not talking about having to include massive exercise regimens. They'll help, but they're not necessary for that 60% risk reduction. You don't have to meditate, although I recommend that too. You don't have to do yoga. Just eat a healthy, whole food, plant-based diet, and you're going to have a 20% better chance of lowering that risk than you would just popping the pill. So, if you get benefit from this, please comment, like, and share, and have a wonderful, blessed, 3-year-old free day.